Hello, good afternoon. This is Dr. Amihan. Once again, your humble servant in health in the northern part of Antique. Today, we are about to discuss the difference between common colds and flu or influenza. And now we have to define what is common cold. It is an infection of the nose, throat, and the sinuses of or upper respiratory tract. Is caused by rhinoviruses, coronavirus, your RSV or your respiratory syncytial virus, and parainfluenza virus. Your rhinovirus cause 20 to 40% of your common colds, and your coronaviruses involves 20% of your colds, but only 3 or 4 affects people and cause disease. Your respiratory syncytial virus or your RSV and your parainfluenza viruses cause 20% of your colds and serious infections, and it can result to pneumonia in younger populations, including the older populations. So, it is now known to you that your RSV or your respiratory syncytial virus and your coronaviruses or your SARS-CoV-1 can also cause common colds. And your parainfluenza virus can also cause common colds. So, it is now very important to know the difference or the science and to know how to differentiate from one compared to the other. So it is very important to differentiate between common colds and influenza, because it seems that the two had almost the same signs and symptoms. So if this happened at home, it is very important that you can be able to distinguish between the two, okay, based from the signs and symptoms that I will be able to explain to you later or show to you later, okay. Now I have to explain to you the differences between common colds and flu based from the symptoms. Now, first is fever. Fever is known to be high in patients with influenza infection or flu. It is common in children, and this can last 3 to 4 days. And likewise, it also happens in adults, especially patients with comorbidities, patients with uncontrolled diabetes, hypertension, kidney diseases, and liver problems. This flu can cause high fever, and as what I mentioned, even for younger children. With regards to cold, fever is usually not common to happen in adults versus flu. Okay? Now, with regards to runny nose or nasal discharges is very common in common colds, as the name implies. And it sometimes happens in flu, but it usually very common to see patients with nose or nasal discharges in cold patients. So usually the discharges is yellowish in color or greenish in color. Sometimes this can be mistaken as bacterial infections in patients with colds. Now, with regards to nasal stuffiness or congestions. This is common in common colds, and sometimes it happens in patients with flu. Now, with regards to headaches, this is usually mild in patients with common colds, but in patients with flu, this is usually more severe. Okay, so you can find patients with flu suffered severe headache. Now, with regards to body aches and pains, this is sometimes mild in patients with common colds. Sorry, and this is usually severe in patients with influenza. Now, with regards to fatigue, tiredness, and body weakness, this is usually, as what I've said, sometimes mild in patients with common colds, but this is very common in patients with flu. So, if you have flu patients, you observe them that they had a fatigue, tiredness, and weakness. Now, with regards to chills and sweating, this is very common in patients with influenza or flu, and not common in patients with common colds. So now, this is common in flu patients because of the production of high-grade fever in patients with influenza or flu. Now, with regards to nausea, and nausea, this is usually common in patients with, especially in children with influenza, and it is uncommon in patients with common colds. Loss of appetite, this is common in influenza and sometimes in common colds. It is usually common in influenza patients because of the severity of the problem. Because of that high-grade fever, sometimes patient lost some form of appetite. Now, with regards to sneezing, this is very common in colds, and sometimes it happens in influenza patients. Now, with regards to cough, coughing is mild to moderate in common colds, but it is usually intense and severe in patients with influenza or flu infection, because as we have mentioned that influenza or flu involves the lower respiratory tract infection areas or the lungs. So there is an infection there, so the cough is intense and severe. Now, with regards to sore throat, sore throat and chest pain or chest discomfort, this is sometimes common in colds, but in less intensity, meaning it is mild to moderate in common colds. If you have common colds, the presentation of sore throat and chest discomfort is a little bit mild or moderate versus your influenza. Sore throat in influenza is less compared to your common colds, but chest discomfort and chest pain is quite common in patients with flu, and this can be severe because of involvement in the lungs. Now, with regards to vomiting and diarrhea, it is uncommon in patients with colds, but it usually happens in patients with influenza or flu, especially in children. The vomiting and diarrhea, we always observe that, especially in our patients in the hospital, where they come to the hospital and most of them had flu or influenza symptoms, and usually accompanied with vomiting and diarrhea. It is a real world experience with regards to children because it is very common in younger populations. Now, with regards to watery eyes, this is common in colds, but sometimes the manifestation is less in influenza. With regards to the serious complications such as bronchitis, pneumonia, exacerbation of your COPD, your chronic obstructive pulmonary disease, and exacerbation of your asthma. This is usually common in influenza, especially patients with comorbidities. Now, with regards to the other complications of colds or common colds, usually you had sinus congestion or congestion of your sinuses. Okay, so this is common in colds, and there is also involvement of your ears. So patients can feel earache and abnormal secretions in your ears, especially if the complications happen in your middle ear that involves your tympanic membrane, and it can cause acute otitis media, where there is decreased sense of hearing, earache or pain, and abnormal yellowish or greenish secretions in the ear of your children, or even in adults, especially if they have diabetes. Okay, so I almost mentioned to you the similarities or differences between common colds and influenza. Now, I have to announce this very important information here in my presentation, that I have to tell you that there is a free giving of vaccines, especially for influenza or flu, prevention of flu and influenza, and pneumonia. So, the Justice Calixto O. Saldivar Memorial Hospital is now having the free giving of free influenza vaccines and free pneumococcal vaccines. Your influenza vaccines can be given once every year or annually. Your pneumonia vaccines can be given every 5 years. Both influenza and pneumococcal vaccines can be given intramuscularly. 0.5 ml of such vaccines can be given through intramuscular route. Okay? As a prevention for flu and influenza illness, and a prevention for bacterial pneumonia. The two vaccines is not 100% protective, but it can reduce or decrease severity of the disease once you are vaccinated or once you get the shot. These two vaccines is a form of prevention. Okay? In patients with influenza or flu, there is a medicine for that. You had your antiviral medicines, your oseltamivir, your sanamivir, your baloxavir, and there's another one for influenza that can be given nasal spray. Okay, but for the prevention, but for the treatment of your bacterial pneumonias, we have so many available antibiotics in our armamentarium for the treatment of pneumonia, bacterial pneumonias. So please grab the opportunity to go there in the Justice Calixto O. Saldivar Memorial Hospital for you to have a free influenza vaccine for the prevention of influenza and flu, and a free pneumococcal vaccine for the prevention of bacterial pneumonia. So grab the opportunity because it is free. Okay? See you there. So this is Dr. Amihan, your humble servant in health in the northern part of Antique, wishing you good afternoon and good luck. May you have the best of everything and Godspeed. Bye.